Welcome to the Wellnest Mamas podcast. We are committed to leading a sustainable lifestyle and making community connections. In a world where stress and chaos seem to be the norm, finding balance and fostering a sense of true well-being is essential.
Whether you are just beginning your holistic wellness journey or are already deeply dedicated to the practice, this podcast is for you. Join the Wellnest Mamas as we uncover the secrets to holistic wellness and discover the power of building a healthy community that supports and uplifts one another.
Sit back, relax, and get ready to embark on a transformative journey to leading a sustainably healthy lifestyle. We're glad you're here.
Hey everybody, we are back for season 2 of the Wellnest Mamas podcast. I am Wellnest Mama Steph.
And I'm Caitlin. And today we have an incredible guest, Miss Kayli Humphreys.
Hello.
Kayli, tell us more about why you're here with us. What do you do?
Yeah, so I am a licensed clinical social worker, which is kind of just fancy words for saying that I'm a therapist for mental health. And I just started my own private practice, holistic healing therapy. I've been a therapist for 5 years, but I've worked for other agencies, community mental health, and just kind of decided to branch off and do my own thing. So I'm excited.
That's really exciting. So you're kind of bringing in entrepreneurship with your counseling experience.
Yes. Yeah.
How does it feel to be an entrepreneur? Is it scary? Is it fun?
It is. It's a little bit scary. There's a lot to learn that I'm like, wow, I wish they would have done some of this in school.
Yes. There's not a good
They don't teach
checklist
you anything, so
this.
it's a big learning curve, but I'm learning it, and I'm in the middle of it, and it's good. So
good. Well, we are so happy that you are here. So how did you find your path to being a therapist?
That's a good question. So I'm originally from Idaho. So born and raised, lived there 95% of my life. I've only lived in Northwest Arkansas for 2 years. And kind of what brought me down that path to be a counselor is kind of my own mental health, as well as like several family members with just mental health challenges, substance use, just a lot of kind of challenges in our family. And so I just kind of decided that's what I wanted to do. My degrees are both in social work, so there's a lot of paths to becoming a counselor, and the path I took was I got my bachelor's in social work and then went on and got my master's in social work as well. And then I've had to do a bunch of like supervision hours with a clinical social worker to even become a clinical social worker, and I actually just got that license within the past couple months. So
congratulations. That's a big deal. We need more people like you in this world. I think it's very important that we have people that can be there for, I'm gonna cry because I'm like so proud of you. It's so cool. I always say, I wish they would make like social working degrees, counseling degrees, they should all be free. There should be no shortage of people that know how to do what you do.
Yes. Yeah, for sure.
Well, I'm interested because you are a holistic therapist. How does that differentiate just from like run-of-the-mill, pick up the phone, like, hey, I need a therapist?
Yeah, I'm kind of figuring that out too a little bit. My kind of own holistic health journey started when I got pregnant with my son. And it was kind of weird how it started, because I was just planning on like regular, go to the hospital, have an epidural, just kind of the very Western medicine route. I had never really thought outside of that before. And a friend shared an Instagram post that talked about potential negative side effects of an epidural. And I was like, that's like really interesting. I've never even thought about that. And that just kind of led me down the holistic rabbit hole, so to speak. And so I read like a lot of like Ina May's Guide to Childbirth, and I read a lot of books, and I got a doula for my birth, and I went mostly unmedicated, and that just kind of led me down that. And then with a lot of therapists, they will like first thing recommend medication, which I think there's a time and place for that, but I think there's a lot of other things that can be done first. Like if you're not eating well and you're not getting sleep and you're not exercising, you don't have like practices in day-to-day life, your mental health's probably not going to be great. Like we need to build the foundation first. And so I think that's a little bit how it differentiates. Is I'm probably not going to recommend that somebody's first line of defense is medication. I'm probably going to recommend, hey, let's look at your lifestyle. Let's see where we can put in some healthier lifestyle practices. Let's maybe try some holistic things, right? Like there's holistic options that are more natural. And so I think that's kind of a little bit of a difference.
Awesome.
That's really cool that you focus on the lifestyle, because I truly think that's what's missing in Western medicine, is that they're trying to like put a pill so that you can keep your lifestyle but have the results you want, when it necessarily if you would, it's like the chicken or the egg. If you get to the root of the issue, which could be, you know, not getting enough sleep or not eating properly, and it is like a sick cycle where you're tired and you know, like
I'm a nurse, and part of my nursing background, I was in sleep research medicine and psychiatric medicine, and so many of our patients overlapped, and they were able to transition out of therapy many times when we got their good sleep under control. So looking at that whole picture is awesome.
Yeah, and there's research, you know, regarding gut health and your mental health and how connected they are. And I don't know a ton about it, but I'm very interested in learning more about that as I, you know, kind of expand my practice, knowing like what that is, and so I can help clients with that too.
Coffee with Caitlin. She's a gut health expert.
The gut-brain axis, it's fascinating. 90% of your serotonin is made in the gut. And your serotonin is your happy hormone. And it's like, well, we need the good guys working for us. And if we're feeding the bad guys with, you know, the candy and the sugar and they have more competition to thrive. So it's fascinating. There's even studies that say there's certain microbes that are more prevalent in people that struggle with like anxiety. So it's like it makes you wonder, like, is it sending signals? You know, like what is the connection? And for me personally, I've noticed a big difference whenever I focused on my gut health and like my mood. And I always wondered, I'm like, what if this is like the root of it, is that your body is like screaming for goodness, you know? I don't know.
I agree.
So you've been in NWA for 2 years.
Yep.
Do you love it?
I do. We love it here. Yeah, my husband works for Walmart. I mean, very classic story, right? Works for Walmart. We moved here. My son was only like 3 months old when we moved, so he's mostly lived here. He's 2 now. And yeah, we love it. Like, we're from Idaho, so it is literally like 8 months of winter there. Like, it's horrible. I grew up with it, and I like winter things. I like to ski, but like by March, and it's still snowing, I'm like, I'm a little bit over it. So we love like that you can be outside basically year round here, right? Like January is a little cold, but the rest of the year, it's really nice, and we love it here.
Yeah, I love that there actually are 4 seasons. You know, they might be short. Like,
you know, but the worst one's the shortest, winter, right?
Yeah, exactly.
Yeah, and all the trails, we love to go on like walks, and there's just a lot of...
So how are you building community here? I know being a transplant, it's kind of difficult. So is that something that you've struggled with when you moved here, or did you find your flow pretty easily?
I mean, yes and no, both, right? Our church community, we've been able to find like a lot of friendships that way. As far as like the business side, like I'm just kind of barely starting that, so finding community with that is like new, but I am in connection with like some other therapists in the area that I know. We go to like lunch once a month, and I'm definitely still working on like building those connections, reaching out to providers who are, you know, kind of in the same realm or space a little bit that can provide referrals and vice versa. So I'm kind of still in the process of doing that.
I love that stage.
Well, I'm glad we can help you with that. So if anybody's looking for a holistic counselor, you might get a call.
That would links and all of that.
Yes.
So where can everybody find your information?
Yeah, so my website is holistichealingtherapy.net, and that has like, you can schedule an appointment on there, you can read all about me. I take, right now for insurance, I take Aetna and Cigna. I'm in the process of being credentialed with Blue Cross Blue Shield. They just take a little bit longer, so I'm hoping by like October I'll be able to take them. And then I have an Instagram. I gotta remember, I think it's holistic.healing.therapist, I believe is my Instagram.
We will
and
link
then
that too.
I'm on Facebook too, Holistic Healing Therapy. So that's kind of the name. You can just search it and it'll pop up, hopefully.
That's really cool.
Yeah.
So tell me, I know when somebody's looking for a therapist, it's funny, I was just discussing this with Steph. I was like, I don't know what you do. Do you go in the first day and you just like dump everything out and you're like, all right, are you ready for this? And like see if they run? Or or do you start with like a small, you know, like task, like I really want to address this immediate need, and this is where, you know, I'm struggling with. When someone's coming for the first time, what can they expect?
Yeah, that's a good question. So I always do a 15-minute consultation with them on the phone for free, just to make sure I'm the right fit for them, they're the right fit for me. Like, I want to make sure I'm going to work with somebody who I have experience on, right? I don't want to have somebody in my office that I've never seen this before. You're probably fit for somebody else. If I'm not the right fit for you, I want to try to help people find the right fit. And so I might direct them to like, hey, go on Psychology Today and put in all the filters of what you're looking for in a therapist, and you might find somebody. Or, hey, I know somebody that works with that. Here's their phone number. Contact them. So that's kind of the first step, is I just have a 15-minute phone call with them, kind of get a gist of what they're looking for, and then I kind of talk about like payment and insurance, you know, making sure that that's something that works for them. And if not, then okay, I need to find somebody who does have your insurance, right? So that's kind of the first step. And then after that, I will send somebody all the paperwork. So similar to a doctor's office, you're going to fill out like a mental health questionnaire. I usually send like an anxiety and depression scale that you do. You'll sign like your informed consent, all your legal stuff, right? You'll sign all that. And then the actual first appointment, I am only virtual right now, so it'll be a video. And just because I don't have I'm not big enough to have a space yet, but someday maybe. And they're actually showing research that video therapy is just as effective as in person, and I really like it. I like being home.
You're not hugging each other.
Yeah. So I think it works well for a lot of people too. You know, not having to drive and not having to do all that. So, anyways. So they fill out all the paperwork the first session. In the first couple minutes, I usually go over the paperwork and like my policies and scheduling and boundaries and all that, just to make sure we're like on the same page. There's a good understanding of that.
So no calls at midnight.
Yeah. Well, they can call me. I just won't answer. Right? And then I take a couple minutes to introduce myself. Some therapists don't do that. I just find that it kind of eases people into being able to be more comfortable talking to me, right? Like I shared a little bit with you. I just told them about like where I went to school and a little bit about my personal life and, you know, things like that. And then I just kind of open it up to them. And it's kind of just a conversation. Like it's just me saying, hey, tell me a little bit about you and your day-to-day life and your family. And yeah, tell me about what you're struggling with. And we do get into a little bit of symptomology and stuff, because I do need to have a diagnosis in that session, especially if they're on insurance. It's, you know, an insurance requirement. So I will ask some questions about like frequency, duration, and things like that of symptoms, so I can then get a good diagnosis. I ask them what their goals for therapy are, kind of what they're hoping to get out of it. And then at the end of the session, we just schedule for the next week. And then usually the second one, we just kind of say, hey, how's your week been? Kind of have a 5-minute almost like small talk, you know, have you been up to anything fun? Like, I think that really does a good job at creating a safe space, right? And then I just kind of ask them, like, do you have a goal for today or direction you want to go? And oftentimes they do, and sometimes they don't. And if they don't, I'll just pull up like the treatment plan and say, well, hey, you said you really wanted to work on this. Would this be a good direction to go today? And then I really try to provide clients with things to do outside of therapy, because while therapy is great, it's an hour of your life once a week or once every 2 weeks, right? Tools. And so what we do in therapy is important, but what you do outside of it is even more important. Like, people are doing their own work. I'm not doing their work, right? And so I really try to provide people with like worksheets or videos to watch or books to read or something that they can also have outside of therapy to rely on as a resource and look at and do throughout the week. So
awesome. That is so cool.
Yeah.
Is there anything else you want to leave us with? Any goals for the community?
I mean, I just want to get in connection with providers. So my niche, like my ideal client, my niche is moms. And everything like perinatal mental health, which is basically just mental health of becoming a mom. And like even before you have a baby, while you're pregnant, after having a baby, there's just a lot that comes with that. And so that's what I love to do. That comes from, I had my own postpartum anxiety, and I didn't even know that that was a thing, because most people only talk about postpartum depression. And I didn't have that. I did not have that, but I did have pretty severe postpartum anxiety. And I was like, wow, I didn't even know that was a possibility. So that's kind of my niche clientele. So just getting in contact with like providers who work with moms, like, you know, we would birth workers
love
and whoever.
to invite you to the birth workers meetup that we do.
That would be great.
It's every month, the first Saturday of the month. This is for everybody in Northwest Arkansas, or come from all over. But basically, it's a place where you can meet providers that are servicing people in that delicate stage of life. You know, there are people that would probably be interested in somebody who specializes in perinatal care. You know, and we were just talking with the doula about how great it would be if they could see somebody before giving birth, because sometimes it's like that could prevent potential birth trauma and future anxiety and depression struggles. So that would be a great place to meet people. You're more than welcome. We do it every month.
Yeah, that would be great. Yeah.
Well, thank you, Kayli. This was so fun.
Thank you. Yeah.
Bye,
Thanks for having me.
Yeah, bye everybody.